Hi everyone, myself Revati and today I am going to give a short information about COVID-19 or coronavirus disease. So, what is COVID-19? It is an infectious disease caused by newly discovered coronavirus. COVID-19 is defined as illness caused by a novel coronavirus now called severe acute respiratory syndrome coronavirus, which was first identified amid an outbreak of respiratory illness cases in Wuhan city, China. It was initially reported to the WHO on December 31, 2019. On January 30, 2020, the WHO declared the COVID-19 outbreak global health economy. Next, how does the COVID-19 spread? COVID-19 spreads mainly from person to person. COVID-19 spreads by droplets produced as a result of coughing or sneezing of a COVID-19 infected person. This can happen in two ways. First one, the indirect contact. The droplets survive on a surfaces and close for many days. Therefore, touching any such infected surface or cloth and then touching one's mouth, nose, or eyes can transmit the disease. Direct close contact. One can get the infection by being in close contact with COVID 19 patients within 1 meter of the infected person, especially if they do not cover their face, coughing, or sneezing. Next, what are the symptoms of COVID 19 or when do COVID 19 appear? Symptoms may appear from 2 to 14 days after exposure. Some people infected with the virus has no symptoms. When the virus does cause symptoms, common ones include fever, dry cough, fatigue, headache, loss of appetite and loss of smell. In some people, COVID-19 causes more severe symptoms like high fever, severe cough and shortness of breath, which often indicates pneumonia. People with COVID 19 are also experiencing neurological symptoms. These may occur with or without respiratory symptoms. For example, COVID 19 affects brain function in some people. Specific neurological symptoms seen in people with COVID 19 include loss of smell, inability to taste, muscle weakness, dizziness, confusion, and stroke. Next, here we can see the confirmed COVID 19 cases in India. Here we can see total cases in Uttar Kannada as well as in Karnataka. Next, what are the precautionary measures to be taken if you have been tested positive for COVID 19? First one, stay home. The first step should be to maintain physical distances as much as possible, which might be a little difficult in a closed space. Also, you have to understand that staying away also includes staying away from things that are touching and using. Make sure you use different bedrooms, washrooms, and other household items. You can keep the infected person in a separate room and ensure that they have all the things that they need over there. A well ventilated room is preferred for some sick with coronavirus. Next, get rest and stay hydrated. Your work doesn't end only by separating the spaces. Even a little bit of carelessness can turn out to be dangerous for you. So, do not take your personal hygiene lightly at this time. Wash your hands properly after touching a contaminated surface and keep your surroundings clean. When you are in close contact with a patient, always wear your protective gear like mask and gloves. Add nutritious food rich in vitamin C, vitamin A, and zinc in your diet. Next, stay in touch with your doctor. It is obvious to feel overwhelmed and stressed out when you are dealing with such a complex situation. Whenever you feel things are getting out of mind, try to keep an open mind and talk to your doctor. This applies to both your physical as well as your mental health. Next, separate yourself from other people. As much as possible, stay in a specific room and away from other people and pets in your home. Finally, the conclusion. The novel coronavirus spread so rapidly that it has changed the rhythm of the globe, whether from the perspective of a single country or multilateral levels. The solidity of international relations has been put under test. A pandemic is not new in human history, but what makes the COVID 19 pandemic special is that it takes place in an unprecedented backdrop when the interconnectivity and interdependence between people, between countries, and between continents are so deep. The achievements people have made in technology, intelligence, and transportation make them both physically and physiologically globalized. Thank you, everyone. Stay home, stay safe.